I did not sleep. I was crying in my sleep. I was shaking.
What are you going to tell my children? I say, your friend, huh? What are you going to tell them?
That's my sister. That's my family.
A day after a deadly apartment building fire in the Bronx, shock and heartbreak continue to resonate across the city. 17 people died in the fire, including 8 children, the youngest just 5 years old. A majority of the deaths were the result of smoke inhalation. The fire was New York City's deadliest since 1990, and the death toll could rise, with more than a dozen still in critical condition. David Ushery is in the Bronx tonight. David, I know it's hard, but if anyone could do it, you can. Can you put into words what the atmosphere is like out there?
Jen, you know, because you've done this as well, we sweep in as reporters and photographers in the midst of tragedy, trying to share with the world what these folks here in this neighborhood has experienced. For many who live nearby, they had to go to work today, they had to carry on, but they'll be changed forever. Certainly those most immediately affected by this will never be the same. And that'll also include the doctors and nurses who had to treat. St. Barnabas is the closest hospital. This is where the patients were first rushed. They have a red phone there so that paramedics on the scene can call them and say, hey, we've got a lot coming to you. We talked to a doctor earlier today who was on the receiving end of that call. He knew that there were multiple traumas coming, but Dr. Ernest Patti couldn't fully brace for what he was about to see. Listen to what he told me earlier.
Dr. Patti, I know this has been a long couple of days for you. We thank you for joining us. I know that hospital staffs, emergency staffs drill for this kind of thing, a multi-trauma event, but still, just looking at this, it seems awfully hard to confront something like this. Take us through the first hours of this tragedy. St. Barnabas, the closest hospital to the scene.
At one point, I saw a paramedic come in, running in, and he said to me, Doc, you're going to get a lot of folks. And as soon as he said that, David, it was like literally a flood. All I saw were 1 stretcher, 2 stretchers, 3 stretchers coming in, people getting CPR, people obviously in cardiopulmonary arrest. And Barnabas is, we're Bronx strong. We mobilized all of our resources from upstairs. Every department that's in the house comes down to help. ICU, surgery, pediatrics, respiratory, everybody from the floor, internal medicine, all the docs come down, anesthesia, and they converge in the ED, split up into teams, and we work in individual little units.
Dr. Patti, obviously the training tells you that it's bad, but what point, based on your years of experience, did you see a patient or start to see something and say, oh man, this is really going to be bad, other than the paramedic telling you, you know, just from your years of experience, like, oh no.
What hit me probably the most, David, was the first couple of patients that came in were adults. And they were in extremis, and we had to do CPR on them and resuscitate them and put them on ventilators. Then I looked down the hall out of the trauma bay, and I could see them bringing in a small patient, a pediatric patient. You know, you can tell it's small because you look at the stretcher and you see a lot of white sheet, you know, and you don't see much of and I go, oh my God, that's a pediatric case coming in. And another one right behind it. And that's when it hit me, and I said, wow, this is going to be tough, you know?
How about the mindset for you, Dr. Patti, and the staff now? I mean, we're now the day outside of it. Have you had a chance now to just sit, process? I know you're sitting with us, but, you know, frankly, there's good reason to be concerned for you and the others who had to deal with this, the stress of this in the coming days as you process.
We got our teams together and we did some, you know, impromptu debriefing sessions, because don't forget, I work with folks from all over the world. Our hospital is a true melting pot, St. Barnabas, and we train young doctors in medicine. So we had a lot of young doctors who never experienced anything like this, as opposed to seasoned people like myself who've been through these types of disasters. So we met impromptu yesterday and we had a debriefing. But today the hospital administration was very, very, on top of things, and they organized a meeting for us this morning, which was very well attended by the staff who were there yesterday, as well as other folks who couldn't be with us. Everybody needs to talk about this. You know, it's funny, you get in the car, you drive home after a shift like this, and I talk to myself all the time. But sometimes when you get home, it's hard to explain to folks, you know, what you've experienced, because they weren't there. They don't have an idea. This was not, just another day for us. This was a day that affected all of us deeply. And and still does. And, you carry these patients with you in the back of your heart for a long time.
Dr. Patti and I had a few moments to think about some of the tragedies we've seen in this city, ones in which he treated the patients and ones in which I've covered, most of them the same. But he says the sight of those pediatric cases coming in yesterday, he'll never forget. There are several ways to help those who've been affected by this devastating fire. You can go to NBCNewYork.com to find out more, but Mayor Adams has come up with a list of organizations. They need supplies. They need a lot of things right now. They need our compassion. So go to NBCNewYork.com, find out specific ways you can help.